think about healthcare, you might first think about the expensive acute care that we read about in the headlines. But if you ask family physicians, they'll tell you that 90% of your healthcare is in the community. But really, who provides almost all of your healthcare? It's not doctors, it's not nurses or other healthcare providers like me. It's you. Real healthcare is self-care. The best predictor of your future health are the habits you practice today. So the 4 foundations of good self-care are what you eat, what you do, how you feel, and how you relate. What do you put into your body, both healthy and unhealthy things? What do you do with your body? Physical activity that supports all the activities of daily living and helps you do what's meaningful for you. How do you relate to other people? How do you connect at home, work, and school, and with society? And finally, how do you feel? How do you recognize your emotions and how do you manage them? And how do you live a meaningful life? The doctors who compose the divisions of family practice care for our patients in our practices, care for you individually, but now care for our community as a whole. And we're involved in other stakeholders in providing the best healthcare that you can have and to make you the best self-care provider. Let's talk about important urinary symptoms. We all get urinary symptoms, so we start off with them trying to control our bladder. And so aging is like development of babies and children in reverse. So the first things we learn are the last things to go. Just like the most recent things that we remember are the first things we forget as we get older. So bladder control is something we acquire at a young age, but sometimes it gets more difficult as we get older. So having difficulty with urination has to do with the flow of urine. Is the stream strong as it used to be? With the frequency, are you urinating more frequently than usual because you're not emptying your bladder or you have some inflammation? Are you having troubles controlling the bladder? So I promise not to make anyone laugh today because I don't want any accidents. Or it could be due to pain. If you're awake for some other reason, your brain's not producing the hormone that reduces the amount of urine that the kidneys produce. I don't know if any of you wondered that, why you might need to urinate quite a large volume during the daytime, but not much at all during the nighttime under normal circumstances. So if you have a good deep sleep, the brain produces a hormone that reduces the amount of urine produced by the kidneys. That's why your urine's concentrated in the morning. But if you're not sleeping properly or sleeping very lightly, that won't be produced. And then you'll produce the same volumes you produce during the day. So a decreased flow might be due to narrowing of the urethra, the tubes through which we urinate. So that could be due to infection or scarring. So some people have something called urethral stenosis or narrowing, and they occasionally need to see the specialist to widen it, to stretch it out. It could be due to an enlarged prostate. So it's kind of inevitable if men are lucky enough to live to be 80, their prostate will grow from very small when they're 12 years old to very large, that size. And it's sitting right up there at the neck of the bladder, so will definitely cause some obstruction. So that's why older men shouldn't get into those contests at the edge of the pier with younger men. It could also be due to a tumor, like a tumor at the neck of the bladder, in the bladder, or in the prostate as well. So the typical symptoms of a bladder infection are frequent urination, sudden onset, burning on urination. But those are the same symptoms as urethritis, which is a common sexually transmitted infection. So if you have those symptoms, it's really important to get them checked out and treated because a bladder infection can descend and get up to the kidney. So if you have fever, chills, and back pain, that definitely you need to see a doctor right away, maybe even the emergency if you can't get in the same day. And then incontinence is the loss of control of the bladder, and it's highly treatable. So it's so embarrassing that most of us wouldn't want to talk about it with our friends, but don't be embarrassed to talk to your doctor. So we talk to people about stool, bladder incontinence all the time. And if it impacts on your well-being, your ability to enjoy the things that you want to enjoy, you definitely should see your doctor. And I learned this a long time ago. You should always look before you flush. And the older you get, the more important. I'm Canadian-born Chinese, but I learned a lot from my dad watching that Kung Fu TV series. So there's a myth that Kung Fu was invented at the Shaolin Temple for self-defense and self-discipline. But if you've ever been to a Chinese restaurant and gone to the washroom, I think you'll know that it was developed as a way of getting out of the washroom without using your hands. So blood in the urine is never normal, so you should always see your doctor if you have blood in the urine. It could be due to a bladder infection, that's temporary, but if we see that in the urine, I always check it later to make sure it's cleared after the infection is cleared. It could be due to kidney stones, and that could be very painful once you start getting symptoms. It could be due to tumors of the kidney or tumors of the bladder. So it's something that should not be ignored. So look before you flush.